Hello, I am AARP Senior Vice President Jean Setzfun, and I want to welcome you to this important discussion about the coronavirus. Before we begin, if you'd like to hear this teletown hall in Spanish, please press *0 on your telephone keypad now.
Si usted desea escuchar en español, presione *0 en su teléfono ahora.
AARP, a nonprofit, nonpartisan organization with a membership, has been working to promote the health and well-being of older Americans for more than 60 years. In the face of the global corona pandemic, AARP is providing information and resources to help older adults and those caring for them. Across the country, coronavirus restrictions are being lifted, and many people are getting back to traveling, sporting events, and attending cultural events in person. But many older adults are feeling uncertain about how quickly they should go back to normal activities. Many have questions about vaccine effectiveness, particularly with the new COVID variants in circulation, and just how far out into public it is safe to go. Today, we're going to hear from an impressive panel of experts about these issues and more. If you participated in one of our teletown halls, you know that this is very similar to a radio talk show, and you'll have the opportunity to ask questions live. For those of you joining us on the phone, if you'd like to ask a question about the coronavirus pandemic, please press *3 on your telephone keypad to be connected with an AARP staff member who will note your name and question and place you in a queue to ask the question live. If you're joining us on Facebook or YouTube, you can also post your questions into the comments. Hello, if you're just joining us, I'm Jean Setzfun with AARP, and I want to welcome you to this important discussion on the global coronavirus pandemic. We're talking to leading experts and taking your questions live. To ask your question, please press *3, and if you're joining us on Facebook or YouTube, you can post your question in the comments. We have an outstanding set of guests with us today, including a vaccine development and global health expert from the University of Maryland, and also a collections and exhibition and program officer from the National Gallery of Art. I'll also be joined by my AARP colleague, Jesse Salinas, who will be facilitating your questions today. The event is going to be recorded, and you can access the recording at aarp.org/coronavirus 24 hours after we wrap up. Again, to ask your question, please press *3 at any time on your telephone keypad to be connected with an AARP staff member. And if you're joining us on Facebook or YouTube, place your questions in the comments. All right, let me introduce our guest today. Our first guest is Kathleen Neuzil, MD, Director of the Center for Vaccine Development and Global Health at the University of Maryland School of Medicine. Welcome back, Dr. Nuzul. And we also have Kate Hall. Kate is the Collections, Exhibition, and Programs Officer at the National Gallery of Art. Thanks for joining us today, Kate.
Thanks for having me.
Wonderful. All right, before we get started, just as a quick reminder to ask your question, please press *3 on your telephone keypad, or you can drop your comments in the section of Facebook and YouTube. All right, jumping right in, Dr. Nuzul, let's talk a little bit about what's happened since you joined us last. I think it was April, when you were on the show last. There's been multiple variants. The latest ones that we're hearing about from India appear to be more serious. What's the new risks coming from the Delta variant?
Yeah, as you said, the Delta variant was first recognized in India, spread very quickly, is now a predominant variant in the United Kingdom, and of course, we're seeing it here in the U.S. It does appear to be more transmissible, so spreading from person to person. It may also cause more severe disease. I think the jury is out there, and we need to learn a little bit more. The good news is that the vaccines, at least the vaccines we're using in the United States, appear to be highly effective against the Delta variant. So very good news and another reason to get vaccinated.
Sounds good. Thank you so much for that. A quick follow-up on that, Dr. Nuzul. How effective are the current vaccines against the variants? And do the proliferation of variants suggest that we are going to need a booster at some time soon?
So it's difficult to answer specifically because different trials of different vaccines occurred when different variants would be circulating. So we don't really have head-to-head comparisons necessarily. And I also caution about those head-to-head comparisons. You know, populations are different, timing of vaccine is different. That being said, it's really that Beta variant from South Africa for which we've seen the lowest efficacy, and that was seen in the Middle East, and that efficacy was still about 75% with efficacy against severe disease of close to 100%. You know, the Delta variant, we have less overall data. Again, the data look positive. It looks close to 100% against severe disease. And I would also add that we have a lot more data on immune response, which again is lower than the original strain, but still quite robust.
Really good news. So sounds like the vaccine's holding up pretty well then.
Correct. I would say yes, the vaccine is holding up well, and we just need to encourage the remaining members of the population to get it.
That's great. I think that is good news for the holdouts. So thank you for that, Dr. Nuzul. All right, Kate, I'm going to turn to you. And again, thank you so much for joining us. With sort of the good news of the vaccine, travel and unique experiences are on so many people's bucket lists, and people are reconsidering it now. So where do arts and cultural institutions fit in this sort of happier post-pandemic life?
Yeah, well, thank you again for having me, Jean. You know, all of us who love museums, we come to museums for the opportunity to experience beauty, to learn about our own time, about history, and to explore our shared humanity. So that opportunity that museums provide to learn and experience new things or look at things we thought we understood in new ways is so important to feeding our curiosity and keeping life interesting. And museums did such a wonderful job of making content available online during the pandemic, but nothing replaces the real thing. And, you know, in multiple studies, engagement with visual arts has been found to improve cognitive function in older adults. And doctors have even prescribed trips to art museums to stimulate neural activity and improve patients' sense of well-being. And so we want you here, and we believe that coming and looking at art is good for you. And for those who may still feel a little anxious about jumping back into the activities that we enjoyed before the pandemic, something to consider is that recent studies suggest that visiting museums is actually safer than most other indoor activities because museums tend to have very strong ventilation systems, and also we are big spaces where it's pretty easy to maintain social distance.
Well, that sounds great. I think it's not only good for your mental health, your brain health, but it's also really safe. That's really good news. Thank you for that, Kate. And I know that with restrictions being lifted for fully vaccinated people across the country, it's time to return back to the things we love, including the arts. So, in addition to what you just shared with us in terms of how safe museums are, how have museums across the country adapted to the pandemic? How are you preparing for fully reopening at the National Gallery of Art, which is happening pretty soon, right?
Well, we actually opened we have two buildings at the National Gallery. Our West building, which houses our old master collections, opened last month, and our East building, which houses modern and contemporary art, is actually reopening tomorrow with some great new exhibitions and installations. And we are so excited. You know, we exist to serve the public, and it's been really sad for us to be here without anyone in the building for so long. So please come back. For us, some of the things that we've done to adapt, even as we reopen, our hours are still slightly shorter than usual, just to give our staff extra time to clean. Like most museums, we are currently limiting capacity to make social distancing easier. So we're offering free timed passes so that you know at what time of the day to arrive. And we have been requiring masks, although tomorrow we will lift our mask requirement for fully vaccinated visitors and staff, though we will still ask those who are unvaccinated to continue to wear masks. So I'm excited to get to the point, as more and more restrictions are lifted, that we can just wake up one morning and decide to go to a museum, not have to make these reservations. But during this time, it's been a way for all of us in the field to continue to welcome visitors safely.
That's wonderful. And even with the restrictions, too, in some ways it also helps you actually access the art more freely, in the sense that you can get close, not so much closer, but fewer people in the museum as well, I assume.
Absolutely. And we actually are thinking about, well, which kinds of events have we done in the past that tend to get overcrowded and maybe aren't such a great experience for the visitors. And now that we've really learned how to do this timed pass system in a way that's efficient for our staff and a good experience for our visitors, we may employ it in certain situations in the future.
That makes great sense. Well, thank you for that. All right, we are going to get to the callers' live questions very soon. And as a reminder, if you want to ask a question, please press *3. Before we do so, I want to bring in Nancy LeaMond, AARP's Chief Advocacy and Engagement Officer. Welcome, Nancy.
Hi, Jean.
Hello. Nancy, the vaccine rates are continuing to increase. Where is AARP focusing our work as it relates to COVID-19?
Well, considering how difficult last year was, particularly for older Americans who are most at risk, it's a tremendous relief to see that 87% of our 65 and older population nationwide has received at least one dose of the COVID vaccine. AARP fought for big investments in research and distribution, and we worked with federal, state, and local government officials to make sure that vaccinating older Americans was a priority. We also advocated for policies to protect the health of nursing home residents and help millions of older Americans with direct stimulus payments, increased access to affordable health insurance, and, of course, more. We've made a lot of progress, but there's still work to do to ensure that everyone who wants a vaccine can get one, and that people who still have questions get the answers they're looking for. AARP's state teams across the country are continuing our work to reach people like homebound older adults and communities where access to the vaccine has been an issue. And we're also urging governors, state legislators, and local government officials to allocate COVID relief and recovery funding in ways that address the needs of people over the age of 50.
Great. Thanks so much, Nancy. And I know that COVID's still front and center for so much of us. But I know that AARP doesn't limit our work there. How else is AARP fighting for 50-plus Americans today?
Well, the three big AARP priorities this year are financial relief for family caregivers, expanding access to affordable high-speed internet, and lowering the cost of prescription drugs. Now, on the first, this past year put a spotlight on how challenging it can be for families to care for aging loved ones, physically, emotionally, and financially. On average, family caregivers spend close to $7,000 a year on care-related expenses. And that's why AARP is fighting to pass the Federal Credit for Caring Act that was recently introduced in both houses of Congress. This bipartisan bill would create a tax credit for eligible family caregivers to help offset certain expenses. And second, the pandemic has shown that access to high-speed internet is a necessity and not a luxury. Without it, people have fewer opportunities to earn a living, get an education, access health care, and connect with family and friends. AARP state teams, including in Oklahoma, Montana, Tennessee, and Vermont, have successfully advocated for funding to expand high-speed internet to underserved communities. And nationwide, we're encouraging eligible Americans to enroll in the new federal emergency broadband benefit program that helps make access more affordable. We're encouraging eligible Americans to enroll in this program. Now, for resources and more information about EBB, visit aarp.org/EBB or call 1-833-511-0311. And be sure to call or go to the website. I just dialed the number and it works, so I can attest to it. The third area we're pushing for is action to lower the skyrocketing price of prescription drugs. American families cannot afford to continue paying the highest drug costs in the entire world. We need action, and that's why AARP is pushing for prescription drug reform bills in 30 states, and we're urging Congress to allow Medicare to negotiate prices of prescription drugs and to create a cap on out-of-pocket drug costs for Medicare Part D enrollees, and then finally to pass other measures to slow the growth of drug prices. Now, if you want to stay up to date on all or any of these efforts, please visit www.aarp.org/coronavirus. Thanks very much for having me, Jean.
Thank you, Nancy, for leading AARP's fight. Thanks. We always are so delighted when you can join us. Thanks again.
Great.
All right, it's now time to address your questions about the coronavirus with Dr. Kathleen Neuzil and Kate Hall. Again, please press *3 at any time on your telephone keypad to be connected with an AARP staff to share your question. And again, if you'd like to listen to this program in Spanish, please press *0 on your telephone keypad now.
Si usted desea escuchar en español, presione asterisco y 0 en su teléfono ahora.
And now I'd like to bring in my colleague, AARP colleague, Jessie Salinas, to help facilitate your call. Welcome, Jessie.
Thanks, Jean. I'm happy to be here for this important conversation.
Wonderful. All right, who is our first caller, Jessie?
Our first caller is going to be from Robin in Illinois.
Robin, hello. What's your question for us?
Hi. I wanted to take someone out for their birthday Saturday. I am very worried about masks and no masks and all that, and it's going to be an outdoor thing that would be new to me. And as I made the reservation, I found out that the staff of the restaurant only wears masks if someone is unvaccinated. Now, to me, I would think all restaurant staff, food handling staff in the back, should wear masks even if there's no COVID. And that unvaccinated people shouldn't be working in a restaurant at this point. So I'm not sure if I should cancel or if I'm being, crazy or what.
Well, I think it's a very good question, Robin. Dr. Nuzul, can you help Robin with that question?
Sure, it's a good question, and I understand that people are concerned, and of course, it's very difficult to estimate risk in any situation. We have learned a lot about coronavirus transmission in the last year or so, and it is predominantly airborne and aerosolized. So while there may be infection control measures in a restaurant for foodborne illness, the risk of spread while someone is cooking food, for example, through food or through contaminated surfaces would be extremely low. So the major concerns to me, and you have already addressed these, is are you and the members of your dinner party, will they be vaccinated? Are you in an outdoor, well-ventilated place? All of these factors will decrease your risk. Most restaurants are still requiring employees to wear masks. However, in and of itself, that should not unduly increase the risk.
Very helpful. Thanks so much for that, Dr. Neuzil. All right, Jesse, who's on the line next?
Our next caller is going to be Karen from New Jersey.
Hello, Karen. What's your question for us?
Hi, yes, I have a question. My question relates to disabled people who are members of AARP. So we heard how wonderful museums are opening up, et cetera, and how because of the COVID, how museums had to close and create a lot of online content and Zoom seminars. So I'm hoping that going forward that those will continue because your members who are disabled still cannot get out to do and participate, within the museum structures and see them. So will that be continuing and be as robust?
Wonderful question, Karen. Kate, I'm going to turn to you for that.
Yeah, thank you so much for that question, Karen. I think the museum field in general and the National Gallery in particular had been a little behind in terms of digital programming. And so having to bring everything online during the pandemic was a big lesson for us. And we learned a lot about how being online increases accessibility in ways we hadn't thought about, including the ways that you're describing, Karen, for disabled people. So we will continue to do quite a bit of programming online as we move forward. We've learned a lot over the last year plus about what kinds of things can still be engaging when we do them online and what things are sort of less engaging. And we're going to focus our energy on the programs that we think can have the greatest impact in an online format.
That's terrific. That's really good to hear. Thank you for that, Kate. Jesse, going back to the phone lines, who's our next caller?
Yep, our next one is going to be from Russ in Ohio.
Hello, Russ. What's your question for us?
Hi. Hey, thanks for taking the call. Many town AARP meetings and finally got through. To me, it's very serious. I was given a Pfizer shot a while back. I went for my second shot, and they gave me Moderna. The response was they came out, the pharmacist talked to me, said I should be okay. I should be a millionaire if I had enough money. I'm 76 years old. It's not reassuring for them to say I should be okay. I contacted local CDC. Their response was, oh, I've never heard of that. I contacted Pfizer, and they said, well, the efficacy is about the same and everything else. But that's still not reassuring. What's going to happen to me 6 months down the road? I noticed one thing. Since I've had the shot, I've been extremely, extremely tired. Now, I go online and I find things that say, well, they're doing testing. It's still in the testing process, mixing the two drugs. I wish I could get a definitive answer from somebody. And you guys are great. I listen all the time, and I've learned a lot. I hope I can learn a lot today.
Well, thank you for joining us, and thank you for your persistence. Dr. Nuzul, can you help Russ?
Yeah, Russ, it's a great question. I can understand why you would be frustrated. The way that development of these vaccines has progressed, it has been at historic speed with great detail and emphasis on safety, but nonetheless historic speed. And one aspect of clinical trials is that we follow rules, and we follow rules very carefully. And, the rules told us if we're testing the Pfizer vaccine, we use 2 doses of Pfizer, and if we're testing the Moderna vaccine, we use 2 doses of Moderna. So what you are reading is absolutely right. The issue of mixed schedules is now something that is being tested, and hopefully before your 6-month time point, you will know. I will say 2 things. One is we're starting to see data come out that mix and match schedules. So an mRNA vaccine, a Pfizer or a Moderna with an AstraZeneca or a Johnson & Johnson, a mix and match, the immune response looks as good or better if we mix 2 doses of vaccine. So I would say, stay tuned there. I can give you, as somebody who's been a vaccinologist for 25 years, I can give you my personal opinion that it is biologically plausible. The biology and the science tells me that you should have every bit as good of an immune response and an efficacy with Pfizer or Pfizer-Moderna or Moderna-Pfizer. They're very similar vaccines. They're both focused on the spike protein of that coronavirus. And so while I can't show you the clinical trial yet, and again, they're in progress, I can say biologically, I feel confident that you have had a good immune response.
Thank you for that, Dr. Nuzul. Very clear guidance there. All right, Jesse, moving on to the next caller. Who's our next caller?
Yep, our next caller is actually from YouTube. Karengabe asks, she first says that she's fully vaccinated, and she wants to know if she can visit with friends who are not vaccinated, and does she need to do so with a mask or not?
Great question. Dr. Neuzil, I think I'm going to stick with you on that one. What's your general sense around using masks?
Yeah, I tell people we make public health decisions based on, what is best for the majority, what's best for getting our economy going, but individual decisions are just that. They're more individual. So a vaccine, as I've already said, is going to be highly protective for the individual. And we also know that the amount of virus that you're going to shed into the environment if you cough or sneeze is going to be lower than if you're not vaccinated. But it's not zero. So you could certainly choose as a courtesy, if you're going out with unvaccinated people, to wear a mask. It's certainly not going to hurt, and it might help. And I would say there are also people, I keep saying we would encourage the unvaccinated to be vaccinated, but we know there are also people on immunosuppressing medications or with conditions that affect their immune system that would be very high risk. And so I think an abundance of caution would be, even if you're vaccinated, again, to have the courtesy of wearing a mask if you're in close contact with people who don't have good immune systems.
Makes good sense. Thank you for that. Jesse, who's our next caller?
We're going to do one more from YouTube. This came from Lisa in Maryland, and she'd like to know whether there are mandatory health guidelines that art and cultural centers must adhere to when reopening.
Good question. Kate, can you help us with that question?
Most museums are following the guidance of their cities and states. That's what we've done at the National Gallery. So we've paid close attention to what the mayor of Washington, D.C. is advising. And we've listened to the CDC very closely and also consulted with a doctor at the CDC for advice when we have any questions. So it will be a city-by-city, state-by-state policy. And museums are, each state has requirements for different types of organizations and institutions that those places are required to follow. And my experience, talking to colleagues across the country, is that museums are taking those mandates very seriously. And I will say, just to add to that, as we know, a lot of restrictions are being lifted. A lot of guidelines are being loosened around the country, and museums are moving along in step.
Great. Thank you for that. All right, Jesse, who's our next caller?
Yep, our next question is Linda in Louisiana.
That's me.
Hello, Linda. What's your question for us?
Yes, can you hear me?
Yes, we can hear you.
The question I have is, after the second dose of the vaccine, my husband and I took Moderna, and we're over 65 and have multiple medical conditions. And I wanted to find out, we still don't feel comfortable. We go out with a mask because in Louisiana, as you know, the vaccination rate is low. The last I heard, it was still in the 30% range. And so it's a big concern to us that, you know, we don't know what we'll be exposed to. But more concerning, we don't know what our individual response may have been because of our medical conditions to the vaccine. And I want to know, is there a commercial blood test that we could ask our doctor to perform that would be accurate and give us some idea of what our antibody titer level or, you know, antibody level would be?
Mm-hmm. Great. Interesting question. Thank you so much. Dr. Nuzul, can you help Linda with that question?
Sure. Linda, I think actually you ask a series of questions, so I'll try to keep this brief, and you bring up some really good points. The first point is that even though we're hearing incredibly high coverage across the U.S., it's not uniform, and we are seeing communities with different levels of vaccine coverage. And as you have wisely identified, that means risk in certain communities is more or less, and there will be pockets even within a city or a state that have higher risk because there are fewer vaccinated. And so, you know, that's a really good point that you bring up, is this isn't uniform risk. We know that the vaccines performed really quite well, even in older people and older people with chronic medical conditions. So that is positive. There are people, as I alluded to before, who have had organ transplants, other really quite immunocompromising conditions that have not done as well with the vaccine. So it's hard to say where any individual would be in that spectrum. You know, we're cautioning people to be careful about using blood tests. There are certainly tests that identify the spike protein, and that would be the test that would tell you if you had antibody after a vaccine. I would say the caveat there is, and there are many of these tests, and you know, depending on your insurance, you may get a slightly different test, but they all test that spike protein. The challenge there is we really haven't identified yet how much protein protects you, and we are working very hard right now doing analyses that will help us answer that question. So, you know, it isn't a public health recommendation, nor would I personally recommend that people rush out and get one of these tests, because it's difficult to know how to interpret the answer.
Absolutely. Dr. Neuzil, I think you bring up a really interesting point that so much is still being unfolded with ongoing research. Where do people turn to for best information around what's being discovered almost on a daily, weekly, monthly basis?
Yeah, I have to say, even for physicians and researchers in the field, it's really difficult to keep up with the quantity of new information we have. You know, the first place I always go is the CDC website, cdc.gov. They update it on a regular basis, multiple times per day. They have vaccine information, they have disease information, they have public health guidance information, and they also have a wealth of other resources and links to other websites. So if I am not sure where to start, I almost always start with www.cdc.gov, and coronavirus is on the front page.
Very good guidance. Thanks so much for that, Dr. Nuzul. All right, thank you so much for all your great questions, and we will get back to them shortly. And remember, if you'd like to ask a question, please press *3. And again, if you want to listen to this event in Spanish, please press *0 on your telephone keypad now. All right, we are going to turn back to our experts. Dr. Nuzul, we've been talking about this. It's a remarkable time with many Americans turning back to sort of normal as quickly as possible. State and local governments and the CDC have relaxed moratoriums and mask requirements. Should we feel confident? We've heard this from a couple of callers now already. Should we feel confident participating in most public activities if fully vaccinated? And given that some people aren't fully vaccinated, what's the best sort of do's and don'ts around mask wearing and social distancing?
Yeah, again, these public health recommendations are looking at averages. They're going to tend to be conservative, right? That we're going to err on the side of being more careful as this progresses. I think right now we have several advantages. We've already talked about the single greatest determinant of risk is going to be fully vaccinated. And if I haven't made that point, I should make that point. If it's a 2-dose vaccine, you have to get that second dose. Fully vaccinated will decrease your risk more than any other action you can take. Certainly it helps that we're now in the summer months, and being outside in well-ventilated places is going to further decrease the risk. Mask wearing, again, is likely not necessary. I don't want to say absolutely not necessary because, as I said, there may be certain jurisdictions. For example, here in Baltimore City, it was determined that masks should still be worn even after, in the state of Maryland, that restriction was lifted because, again, of the coverage rate in Baltimore City. So local jurisdictions are going to matter. So I want to be sure people are following that. But in general, if you are in a place where masks are no longer recommended, I think you should feel free to not wear your mask. The final point that is really important is in many states, again, including Maryland where I am, and in fact the majority of states, the levels of positive testing for COVID are the lowest they have been since the start of the pandemic. So this is a moving variable here. Right now, I am not only safe because I've been vaccinated, but I'm safe because there are far fewer people that I come in contact with in this area who have had COVID. We will need to follow that. Will we have another wave in the fall or in the winter? And that also brings up special circumstances such as air travel, which is done in less well-ventilated places with people from all over the place where we can't monitor the local COVID positivity rate. So that's why in those situations we're still seeing guidance to wear masks, for example.
Very helpful, very clear. And I think you're bringing up an interesting point here around the overall vaccination rate. I think prompting people to see how effective the vaccine is, I think, is good. But there's also this notion of the overall vaccination rate across the U.S. And we've heard this sort of notion around herd immunity around the 70 to 75% rate. What is there a risk overall if we don't reach that goal?
The vaccine coverage goal?
Yes, the vaccine coverage goal, yes.
Yeah, it's difficult to say because this is a pandemic. So it's not only the vaccine coverage goal, but it's what's happening around us and in the rest of the world. So this issue of emergence of variants, which callers have talked about and you've talked about, this virus changes in settings of uncontrolled spread, which generally means settings where we don't have enough vaccine. And so a lot of us getting out of the pandemic will depend not only on our own vaccine coverage, but on vaccine supply to the rest of the world, so we can keep that virus under control, reduce the chance of viruses emerging that could then spread to the U.S. and elsewhere. So as long as this is still a pandemic and there's uncontrolled virus transmission everywhere. It's hard to point to a single vaccine coverage or single estimate that will completely protect us.
Yes, very good point. So more than just a U.S. issue, it's very much a global issue as well, in addition to looking at the U.S. coverage rates. Thank you for that. Kate, I'm going to turn back to you. As many people have on their sort of post-pandemic must-do list, visits to museums or cultural attractions outside of their community, and perhaps, as we've been just talking about, internationally. What kind of resources are available to help people understand local requirements or restrictions? And can museum staff, for example, give you a more comprehensive look at sort of what to do when you're visiting or where to go for that information? Kate, I'm not sure if you can hear us still, if you're on.
Whoops, sorry. I'm sorry. I have noticed, having been able to do a little bit of traveling myself since I was vaccinated, that museums have done a terrific job of making information about what is required to visit their institution right up front on the homepage of their websites. It's very clear, very specific, letting you know the steps you need to take before your visit and what you'll need to do while you're there. I'm not seeing so much information on museum websites about local city or state guidelines for travelers. And I think that's partly because they're changing so quickly. So I think the best place to go, no matter where you're traveling or what you plan to do, is to the local government website to see what's happening in that place at that time. As I said, things, as we all know and we're hearing on the news, restrictions are lifting quickly. So it's hard for museums to keep up with their information. Having said that, most museums will also have a phone number that you can call. We have several staff members who staff our phone line every day, and they're busy all day long answering questions from visitors, and they can provide a little bit of context.
That's great. Thank you for that. A quick follow-up to this, and one of the previous callers actually asked a question related to this, but I'm curious, the job that I do at AARP is very much focused on education and programming, and we've had to switch up our activities quite a bit, moving completely away from in-person to online, and we've thought a lot about sort of this hybrid mode and keeping it more even when we do go back to normal. So curious to hear again from you on sort of the different ways that you're thinking about it for the National Gallery of Art, how other museums are thinking about sort of mixing up the way that they do engage people both in person and online. What are some of the changes that you're likely going to keep?
Yeah. Well, I mean, this was an unplanned experiment for all of us, wasn't it?
It was.
And we have learned a lot about things that we thought we might be able to sort of pivot and put online, and it didn't really work. But we've learned even more about things we never thought we could do virtually that worked really well. And I'd love to give just one example of a program that we've had for a number of years called Just Us. And this is a program that we do for people with memory loss and their caregivers. And this is a program that we know, because our visitors have told us, has been really meaningful to families who are living with a loved one with memory loss for a long time. But what we've been hearing since we took this program online during the pandemic was just how important it was for families who really, logistically, it's so hard to get their loved one to the museum to participate in the program. And being able to be in their own homes without having to sort of get in a car and get to the museum, and maybe they need to get a wheelchair, and it can be disruptive and unsettling for their loved one with memory loss. They can sit in their homes, participate in the program together. It provides a moment of connection. This is a program where participants look at 2 works of art over the course of an hour, and they engage in conversations that are really built around personal responses in the moment that don't rely on memory or previous knowledge. And this is a program that we will absolutely, one of a number of programs that we will absolutely continue online, because we've realized we can reach so many more people in a way that works better for them.
What a nice way to connect. That's fabulous. So it's called Just Us, and can people find it on your website?
They can at www.nga.gov.
And search Just Us?
They can search Just Us, or they can just click on the menu bar for education.
Fantastic. Thank you so much for that, Kate. All right, we will be
I
turning...
have to correct myself. We've changed that to learning. Click on the menu bar for learning.
No problem. So www.nga.gov and search on the tab Learning.
Yes.
Great. Thank you for that, Kate. All right, we will be turning back to your questions just shortly. And before we do, I want to address an important issue. We know that some of you are still having challenges accessing the vaccine due to transportation or mobility issues. AARP wants to help. The AARP Vaccine Finder support team is available to try to connect you to community resources that can transport you to your vaccine appointment or come to your home. So if you're listening today and can't get a vaccine because of transportation or mobility issues, please press 1 to be added to a list to receive a call from an AARP staff member to assist. Again, if you're listening today and can't get a vaccine because of mobility, transportation issues, please press 1 to be added to a list to receive the phone call. When you do press 1, you'll listen to a brief message and then be returned to the call. All right, now it's time to address more of your questions with Dr. Kathleen Neuzil and Kate Hall. Please press star 3 at any time on your telephone keypad to be connected with an AARP staff member. All right, Jesse, who do we have on the line now?
Our next caller today is going to be Olga from Connecticut.
Hi, Olga. What's your question for us?
Thank you for taking my question. It has been almost 4 months since my second dose of Pfizer vaccine. Have I waited long enough, and is it safe to make a dental appointment and also have some work done, lab work, which they will be able to draw my blood?
Great question. Thanks so much for that, Olga. Dr. Nuzul, is it safe for Olga to do some necessary activities after 4 months of being vaccinated?
Sure. So, Olga, first of all, thank you for getting both doses. And again, just to emphasize that really with the mRNA vaccines, you need 2 doses. We feel that immunity is really good and very high within about 2 weeks after that second dose. So 4 months, you should be fine. I should comment on the other end of that because people are starting to worry about when efficacy might start to go down again. And we have really good news on that front, too. We've followed our clinical trial participants out to 8 or 10 months, and we continue to follow them, and it still looks good. So, yes, 4 months should be safe for you to go and do what you need to do.
Great news. Thanks so much for that, Dr. Nuzul. Okay, Jesse, who's our next caller?
Our next caller is going to be Linda in Pennsylvania.
Hi, Linda. What's your question for us?
Hi. My question was, I keep hearing about the variant, the Delta variant, and they always say just Pfizer is, more, it's covered by Pfizer, but never say about the Moderna. Is that give you the same coverage as the Pfizer?
Good question,
against
Linda.
The variant?
Yes, good question, Linda. Dr. Nuzul, I think we're going back to you on this question again.
Yeah, these calls and questions are keeping me on my toes because, Linda, you have been listening very, very carefully. The vaccine that got out there first, so for which we have the best data on efficacy against that Delta variant, is the Pfizer vaccine, and really quite high against severe disease after 2 doses. We don't yet have the same kind of data for the Moderna vaccine. We do, though, have very good immune responses against the variant that look as good as Pfizer. So we're making that connection while we're waiting for the rest of the data that Moderna will perform as well as Pfizer. But you have been listening and reading very carefully.
Thank you for that. All right, Jesse, who's next on the call line?
Yep, we're going to bring on Marshall from Maryland.
Hello, Marshall. What's your question for us?
Hello. Well, I'll start off. I had 2 shots of Moderna plus 2 months. I've got a 2-part question here. Part 1 is travel, and part 2 is destination. We just got an invitation to a wedding out in the Midwest, mid-August, very rural area in Kansas, and I contacted the health department of that county to find out what their story is right now in Kansas. And I'm told that they have no cap on gathering sizes and no issue on masks. And so their determination is nobody tells anybody about masks or shots. And currently, the senior inoculation is up to about 70%. And all adults are around 35%. And talking with some of my cousins out there, the attitude in much of that part of the rural Midwest is they don't want to get shots and they don't want to wear masks. So my risks are, let's see, I'm a senior citizen and I have a chronic health condition. My risk would be first airplane ride back and forth, which probably is not too bad. But my destination issue is bad, I think. Likely to be a big wedding, maybe 100 people or so at the wedding. And the last time we had a wedding was October 17th, big wedding. And after talking with one of my uncles, about 2 weeks after the wedding, 50 people were the proud recipients of COVID-19 directly from that wedding. 20 of them are my cousins. I don't know what to do about going out to the wedding.
Yeah, tough question, Marshall. I'm going to toss it back to Dr. Nuzul again in terms of weighing this decision and the risks associated with that.
Yeah, and it is weighing individual risk. I'm sure all the callers can appreciate that I can't really advise individuals, just perhaps help you frame the decision. I will say that before vaccination, weddings and family gatherings were big drivers of the pandemic and the individual risk because people were complying with overall restrictions, but the family was a bit of an exception for a while, and people were willing to do those sorts of gatherings. So it doesn't entirely surprise me that your family experienced an outbreak in that setting. Again, your risk is dramatically reduced because you've had 2 doses of the vaccine. You will be asked to wear a mask while flying, and again, the airports and the airlines have really done a good job about enforcing that mask wearing. And then when you get to where you're going, it's the risk to the unvaccinated that will be greatest, but a lot of it will depend on not only the coverage in the area that you're in, and if you feel uncomfortable, I would say certainly wear a mask, if you go to the grocery store or somewhere publicly. But at the wedding, it will be more dependent on how many people at that wedding have been vaccinated. Is it indoor or outdoor, with outdoor being less of a risk, for example. So, again, the biggest determinant that will help you lower your risk is that you've had 2 doses of the vaccine.
Great. Thank you. Thank you for laying that out in the framework as well, too, Dr. Nuzul. Very helpful. All right, Jesse, who's our next caller?
Our next question is actually from Facebook, and this is from Chrissy Abrams. She's a grandparent. And her question is, if you're vaccinated and you want to go visit younger people, in particular her grandchildren who are 4 and 5 years old and not able to get vaccinated, does she have to wear a mask?
Good question. Dr. Nuzul, I'm tossing this back to you again about unvaccinated kids, what to do about that.
Sure. And, kids have been affected by this pandemic, definitely. They've certainly been affected socially and developmentally. Their risk of severe disease is considerably lower. It's not 0, but it's considerably lower. So the general recommendation is if you've been vaccinated, you don't need to wear a mask. If the only exception to that would be if your grandchild has some chronic health condition that would make them more susceptible to COVID or to severe COVID.
Makes sense. And I know that there's also been news of late related to the variants and the effects of younger individuals internationally. What are your thoughts around that?
Just in terms of sometimes it's hard to sort out behavior of younger individuals, versus the effect of the virus and the variant. We certainly saw that in the U.S. with younger people not conforming to rules as well as older people that are conforming to rules. So certainly, again, we're learning more about the Delta variant and if it may be more severe in all ages. Some of what we're seeing could also be behavior related.
Mm-hmm. Makes sense. All right, I'm not letting you off the hook, unfortunately. I'm actually going to turn back to some questions that we've had developed in advance, and one of the ones that we've been thinking a lot about is the news that Johnson & Johnson's CEO has publicly said that people may need an additional dose of the COVID vaccine along with an annual flu shot. What's your opinion of that?
Yeah, so the issue of booster doses is certainly a hot topic right now, and just to remind everybody that the Johnson & Johnson vaccine is a single-dose vaccine. That is how it's licensed. They are doing a second study, and I hope we'll hear the results soon, about a two-dose version of that vaccine. So it may be a bit of a different question if a Johnson & Johnson needs a booster, right, which would be a second dose, versus Moderna and Pfizer needing a third dose. Right now, the conversation is ongoing, the studies are ongoing, and the data are starting to come in. Right now, scientifically, there is no indication of a short-term need for a booster dose. The immune response data look durable. I've talked about 8 to 10 month data. We've seen 6 month and more efficacy data from Moderna and Pfizer that look really, really good. So I don't want it to scare people that you're hearing talk of a booster, that means we need a booster. The reason there's talk of a booster is because, in the end, this COVID vaccine program is going to be the largest vaccination program in the history of the United States. So if we're going to think about a booster logistically, we have to start thinking about it sooner instead of later. Mm-hmm. But at the moment, there is no scientific indication for it in terms of immunity is waning, efficacy is going down. It's a conversation realizing the enormity of the decision and the enormity of the logistics should we eventually decide that a booster dose is needed.
Great. Thank you so much for that, Dr. Nuzul. All right, Kate, you're going to get the last word here. How might someone who's never considered themselves artistic explore and express themselves now that we've all seen our lives in a different light?
Yeah. Well, I'm not sure this exactly answers your question, but I think that people who haven't dipped their toe in the water at art museums maybe haven't done it because they didn't feel like art museums were for them. And the trend in museums now is to recognize that we're here for everybody. You don't need a PhD to come through the door and look at a work of art and experience it in whatever way is meaningful to you. And so across the country and really around the world, museums are looking at museum visits as a time for visitors to bring their life experience to the table, to respond to works of art in ways that are meaningful to them. And if you want more and you want history and guidance and context for what you're seeing on the walls, we're happy to give that to you too. But we really want to be in conversation with the people who come to visit us. What is it you're looking for? What do you want to see? What does this mean to you? And I want all people to know that they're welcome. So we look forward to seeing you come through our doors in the East Building as of tomorrow and in the West Building even as of today. And I know I speak for my colleagues around the country when I say that.
Wonderful. Thank you so much, Kate. And I'm personally going to make a visit myself because I'm dying to make a visit to really kind of feed my soul with art.
Yes.
So that's terrific.
And I will say that, being out in the galleries as we have welcomed the public back over the last few weeks has been so gratifying to hear people's enthusiasm for returning. There are people who are even in tears. They're so happy to be back and seeing some of their old favorite works of art. And so we welcome everyone to experience that.
Thank you so much. Well, I really want to take time to thank both of our expert panelists. I personally learned so much, and we really appreciate all the answers to the questions that we posed to you today. And of course, I want to thank all of you, our AARP members, volunteers, and listeners for participating in this discussion. AARP is a nonprofit, nonpartisan organization with a membership, and we've been working to promote health and well-being for older Americans for more than 60 years. In the face of this crisis, we are providing information and resources to help older adults and those caring for them protect themselves from the virus and prevent its spread to others while taking care of themselves. All the resources that we referenced today, including a recording of today's Q&A event, can be found on aarp.org/coronavirus on June 18th. That's tomorrow. And again, that web address is aarp.org/coronavirus. Go there. If your question wasn't answered, you'll find the latest updates as well as information created specifically for older adults and family caregivers. We hope you learned something today that will keep you and your loved ones healthy. And please join us on June 24th at 7 p.m. Eastern for a special live event where we'll address COVID's impact on the LGBTQ community. We hope you can join us for that. And thank you again. Have a wonderful day. This concludes our call.